For the first time in nearly 7 years, the US government has entered a shutdown on 1st of October 2025. The shutdown comes after a disagreement between the Republicans and the Democrats over the Medicaid cuts in Trump's new funding bill, dubbed the Big Beautiful Bill. The Senate failed to pass the continuing resolution to keep funding the government at the current level. The US government was on the verge of shutting down unless Congress reached a funding deal before the start of the new fiscal year on 1st of October. On September 30th, with fewer than 48 hours left before the deadline, White House negotiations failed to resolve the funding impasse. Congress was supposed to approve 12 appropriational bills by 30th September to fund government operations for the next fiscal year, but none was passed. The Democrats demanded to reverse the Medicaid cuts in the Big Beautiful Bill, which was passed earlier this year. Meanwhile, the Republicans dismissed the demands and in turn proposed to extend funding until November 21. Notably, Republicans control both the Senate and the House of Representatives. Now, this takes the US back 7 years to Trump's first term as president, when the country last saw a government shutdown. That one stretched for 35 days before Trump gave in. At the time, he was demanding funds from the Senate to build the US-Mexico border wall, but the Senate dismissed. But wait, what is a government shutdown? What does it mean? A government shutdown happens when Congress can't approve funding for federal agencies, and without that approval, those agencies can't spend money. Since 1980, the US has seen 14 shutdowns. The last one was in 2018 and it dragged for 34 days. So what happens during a shutdown? In a shutdown, the federal government has to pause all non-essential work until Congress approves funding. Programs funded by other sources like fees or separate laws can continue. Each agency decide what's essential and what's not, while members of Congress make the same call for their own staff. Essential services related to national security and public safety, like patient and emergency medical care, air traffic control, law enforcement, border security, disaster aid, and power grid maintenance continue, though they may face disruption. Services independent of annual appropriation bills such as the US Postal Service, programs like Social Security and Medicare also continue but may experience interruptions. The Congressional Budget Office estimates that the shutdown could cost the US economy around $400 million per day, as up to 750,000 federal workers could be furloughed. At the Federal Aviation Administration, more than 11,000 employees, about a quarter of its staff, could be furloughed if funding lapses. US airlines have warned that a partial shutdown could disrupt air travel, as air traffic controllers and security officers would have to work without pay and other functions would be paused. To keep flights safe, over 13,000 active air traffic controllers would continue working, but they won't be paid until the shutdown ends, the FAA said. The FAA is already about 3,800 controllers short of its staffing target, but even if funding stops, it says hiring and training will continue. During previous shutdowns, the FAA had to suspend most hiring and training activities. A government shutdown, whether partial or full, can have wide-ranging impacts on public services and programs. During the 2018 to 2019 partial shutdown, the Food and Drug Administration had to suspend routine inspections, which increased public health risks across the country. The National Park Service was forced to stop trash collection and road repairs, creating unsanitary conditions and unsafe roads, while several national parks and museums had to close entirely. Meanwhile, over 86,000 immigration court hearings were cancelled, worsening already significant backlogs and delaying justice for many individuals. The shutdown also threatened programs like the temporary assistance for needy families in certain states, putting low-income families and children at risk. These disruptions clearly illustrate how government shutdowns affect not just public services but also society's most vulnerable members, highlighting the real-world consequences of political deadlock. A deep standoff between Republican President Donald Trump and congressional Democrats has triggered the 15th US government shutdown since 1981. So how can this US government shutdown be put to an end? First, let's see what Republicans want. Trump's Republicans control both the House and Senate and passed the One Big Beautiful Bill in July, boosting defense and immigration spending, cutting Medicaid, and rolling back some Democratic priorities. They say they are willing to pass a temporary funding extension through November 21 to give more time to negotiate a full-year budget. So what Democrats want? As the minority party, Democrats hold key leverage in the Senate. They are pushing to renew and expand healthcare subsidies under the Affordable Care Act, which otherwise would expire at year-end, and want protections to ensure Trump cannot override these provisions. They also want some ACA restrictions from the July bill reversed. Now, how the shutdown could end? The shutdown will likely continue until both parties agree on a funding deal. Republicans need at least a few Democratic votes in the Senate to pass any spending bill. A compromise could involve a temporary funding extension while negotiations continue on healthcare and other contentious issues. So what do you think of the whole matter? Share with us in the comment section below.
If you like this video, then like, share and subscribe to ET Now.